Today my topic is on abducens nerve. It is sixth cranial nerve. It is purely motor nerve. It has an intimate relation with the facial nerve. So, I will discuss on origin of the abducens nerve, then course and distribution of abducens nerve. So, first of all, origin. Abducens nerves arises from the brainstem. The nucleus, abducens nucleus, is in lower pontine area. Lower pontine area beneath the upper part of the floor of fourth ventricle. At the level of facial colliculus. So now let us bring the picture. This is a transverse section of pons, and this is the abducens nucleus in each side. From this nucleus, the abducens motor nerve fibers arise and goes downwards and forwards and comes out from the pons. And this nucleus is the lower pontile area, so it is located in the lower pontile area, and this is the fourth ventricle, and this is the floor of the fourth ventricle. This nucleus is located beneath the floor of the fourth ventricle and at the level of the facial colliculus. This elevation in each side, this elevation is called facial colliculus. So, at the level of the facial colliculus, the abducens nucleus is situated. And one thing I have told, that it has an intimate relation with facial nerve. This is the motor nucleus of the facial nerve in each side, and from this nucleus motor fibers arise, and instead of coming forward, it goes backward and make a round to the abducens nucleus, and then comes downwards and forwards and comes out from the brainstem. So while making a round, it makes an elevation at the floor of the fourth ventricle. This elevation is called facial colliculus. So now I think it is clear the origin. Now I will show the area from which the now abducens nerve fiber come out from the brainstem. This is the longitudinal view of the brainstem. This is pons, this is medulla oblongata, and these are the pyramids of the medulla oblongata. And in each side the abducens nerve fiber arise. So in between the lower part of the pons and upper part of the medulla oblongata, the abducens nerve fiber arise, come out. So now the course of the abducens nerve. So this is pons, this area is pons, this is medulla oblongata, this is fourth ventricle, and this is the floor of the fourth ventricle, and this elevation is called the facial colliculus, and at that level the abducens nucleus is situated, and from this nucleus the abducens nerve fibers arise and goes downward and forward, and from the lower sulcus of the pons it comes out from the brainstem and then goes through a bony canal known as Dorellos canal. The bony canal known as Dorellos canal. This is the Dorellos canal. This Dorellos canal is situated at the apex of the petrous temporal bone, and then it goes medially to the cavernous sinus. This is the cavernous sinus, and then enters the orbit through the superior orbital fissure, and then it supplies the lateral rectus muscle of the eye bone. So the muscle I will show. These are the lateral rectus muscle, and this is the abducens nucleus in each side, and from this nucleus the nerve fibers comes out of the brainstem, and then it goes to the lateral rectus muscle and supply it. So what is the function of the lateral rectus muscle? When you look laterally, due to the movement of the lateral rectus muscle, we can look laterally. That is, laterally means towards the head. When our left eye looks laterally, that is towards head, the right eye moves medially, that means towards nose. So if there is any damage of the abducens nerve, then what happens? In this case, this is the left eye, and when the left eye looks laterally, that is towards the head, if it is damaged, the abducens nerve is damaged, then it fails to look laterally, but the right eye looks medially, or that is towards nose. Medially means it turns towards nose, but it cannot, it fails to turn laterally, that is towards head, due to damage of the abducens nerve. So now today I have completed the origin of the abducens nerve, the course and the distribution of the abducens nerve.